Imagine your blood as a pot of thick soup. Too much soup and it gets crowded, too little broth and it becomes overly thick. Gaisbock syndrome is like having a pot of soup that seems too thick. The plasma in your blood is reduced. This condition elevates red blood cell concentration. It's not due to overproduction of red blood cells. It's a matter of volume. Decreased plasma volume creates a relative increase in red blood cells. Our bodies strive for balance, a state known as homeostasis. In Gaisbock syndrome, this balance is disrupted by a reduction in plasma volume. This can occur due to factors like dehydration, smoking, obesity, or stress. As plasma volume decreases, the concentration of red blood cells appears to increase. Imagine squeezing a sponge soaked in water. The amount of sponge material remains the same, but the water is squeezed out, making the sponge appear more concentrated. Similarly, in Gaisbock syndrome, the plasma, like the water, is reduced, leading to a relative increase in the concentration of red blood cells. This understanding is essential in guiding both diagnosis and treatment. By addressing the root cause of the decreased plasma volume, we can effectively manage Gaisbock syndrome. Restoring the body's natural equilibrium is key. Gaisbock syndrome often presents a medical mystery, as the underlying causes can be multifaceted. Dehydration is a common culprit, resulting from insufficient fluid intake, excessive sweating, or the use of diuretics. Obesity can lead to a relative decrease in plasma volume. Hypertension or high blood pressure is also linked to Gaisbock syndrome. Smoking, with its detrimental effects on blood vessels, is another risk factor. Nicotine, a vasoconstrictor, can further exacerbate the problem by narrowing blood vessels. Stress can also play a role, impacting fluid balance and blood vessel constriction. Certain medications, particularly diuretics, can contribute to dehydration and increase the risk of Gaisbock syndrome. Understanding these risk factors is crucial for prevention and management. Addressing these factors can help mitigate the condition. Gaisbock syndrome is often a silent stalker, lurking without noticeable symptoms. Many individuals remain unaware until a routine blood test reveals an elevated red blood cell count. When symptoms do arise, they are often subtle and easily attributed to other causes. Common symptoms include fatigue, headaches, and dizziness. Fatigue can be due to the thickened blood's impaired ability to deliver oxygen efficiently. Headaches may be related to changes in blood flow and viscosity. Dizziness, particularly when changing positions quickly, can be attributed to reduced blood flow to the brain. Shortness of breath during physical activity is another potential symptom. These symptoms are not specific to Gaisbock syndrome and can be caused by various other conditions. A thorough medical evaluation is crucial to determine the underlying cause. Diagnosing Gaisbock syndrome is like piecing together a complex puzzle. It begins with a routine blood test revealing an elevated hematocrit or hemoglobin level. However, this finding alone is not enough to confirm Gaisbock syndrome. It's crucial to differentiate it from other conditions that can also cause an elevated red blood cell count. Polycythemia vera is a rare blood cancer that causes the bone marrow to overproduce red blood cells. Secondary polycythemia is caused by an underlying condition that leads to increased red blood cell production. A thorough medical history, including any risk factors, is crucial. Laboratory tests play a vital role in confirming the diagnosis. Measuring plasma volume is essential to determine if it's truly decreased. Additional blood tests can help rule out other conditions. Treating Gaisbock syndrome focuses on restoring the body's delicate equilibrium. Lifestyle modifications are key. Hydration is paramount. Increase fluid intake, preferably water. Weight management is crucial. Even small weight loss helps. Exercise cautiously. Avoid dehydration. Stress management aids treatment. Quit smoking to improve health. These steps manage Gaisbock syndrome. The prognosis for individuals diagnosed with Gaisbock syndrome is generally favorable. It's not typically associated with long-term health consequences. Addressing underlying causes and mitigating risk factors is key. Focus on hydration, weight management, and stress reduction. Regular medical follow-up is essential. Blood tests will be conducted periodically. Lifestyle modifications may need adjustments. With a proactive approach, individuals can live full lives. Gaisbock syndrome highlights the importance of awareness among healthcare professionals and the general public. Early recognition and accurate diagnosis are crucial. A high index of suspicion is paramount for healthcare providers. Thorough medical history, physical examination, and lab tests are essential. Public awareness is equally important. Understanding risk factors empowers informed health choices. Promoting hydration, exercise, a balanced diet, and stress management can prevent this condition. Collaboration improves recognition, diagnosis, and management. This leads to better patient outcomes and well-being.